Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Vertex Pharmaceutical. Here's your host, Laura Bonnell.
This is our third podcast talking about cystic fibrosis in Egypt. Cystic fibrosis is a genetic disease that causes chronic and fatal lung infections and interferes with digestion in all organs. Our first podcast featured Dr. Samya Nasr from the University of Michigan. She talked about making physicians aware in her native country of Egypt that people do in fact have CF. Egypt still doesn't recognize the disease, although testing for CF has begun, and about 1,000 people were diagnosed since 2007, and that's all thanks to Dr. Nasr's work. Once you're diagnosed, you can start treating your child. Testing can be done because Dr. Nasr acquired sweat test machines. The challenge now is to teach staff how to use them and how to read the results. There was a delay in teaching this year due to the pandemic. Dr. Nasr believes they will diagnose thousands more CF patients over the next couple of years. The average life expectancy for a person born with CF in the United States is 41 years old today. In Egypt, it's between 8 and 12 years old. Life is getting better as medications are slowly becoming more available. In our second podcast about Egypt, we talked with Anis Mansour, a dad of 5-year-old twins with CF. If he is lucky, he acquires enzymes for his boys and one inhaled treatment, hypertonic saline. No real medications, no albuterol or pulmozyme, and certainly no CF modulator drugs that correct the underlying cause of the disease. Today we are talking to Dr. Maggie Naguib. She is a professor at Cairo University and working with Dr. Nasr to change how CF is seen and treated in Egypt. And Dr. Nasr is also joining us on this podcast. Dr. Naguib only learned that CF existed in Egypt when she was shadowing Dr. Nasr at the University of Michigan in 2000. Prior to 2000, she was taught that CF did not exist in the Middle East. We're talking with Dr. and Professor Maggie Naguib. You're at Cairo University. How long have you been working with patients with cystic fibrosis there?
As we were discussing earlier, I was in the University of Michigan doing a visiting professorship in the year 2000. And that was the first time that I had knowledge of, CF patients coming to the clinic and following up. Because in Egypt, we studied CF only in the books, and we were always under the teaching of our professors saying that nobody has CF in the Middle East. It doesn't exist. It's only a disease that you will find if you work in Europe or other countries where there are people from European origin. Other than this, in Egypt, we don't have this disease. It doesn't exist. So when I was there, Dr. Nasr said, no, I don't think it doesn't exist. It's just that people don't recognize CF in Egypt. They think it doesn't exist, but in reality, it probably does. So we did this little experiment. So Dr. Nasr got in touch with somebody who manufactures a very small and portable device for sweat chloride. And we decided to do this study about patients who will fit a diagnosis of CF, but they have diseases that are undiagnosed, let's put it this way, okay? And we're going to test them for CF using this portable device and sort of explore the idea if we get any positive sweat tests. And what happened was that we did find patients with cystic fibrosis. We did the study on 20-something patients, and 11 of them tested positive for CF or had a high sweat chloride. And that was very interesting because that was the first time that anybody had done a sweat test for small children or, in Egypt who fit the profile of symptoms and so forth. And it was very interesting that we did find actually positive sweat chloride test. We did the genetics for those patients, and also some of the genetic tests came in positive. And I thought that was like super interesting because nobody had thought of it before. There had been a study previously by one of our professors. They sort of did the newborn screening. They did the blood spot test for babies, and they tested some of the babies positive. But there was no further part to this study. There was no further, sweat tests being done or genetic tests being done for those patients.
What year did you do that testing? And just elaborate a little bit more on how maybe surprised you were.
We started doing the test. We got the instruments in 2001, and we started sort of doing the sweat testing. It's not the standard sweat test, but that was the only equipment available to us. And we started sort of recruiting the patients who would fit the diagnosis of CF, and they were sick, but nobody knew. There were no diagnoses for their conditions. And we started recruiting those children from the Cairo University Children's Hospital. And we did the sweat chloride test for those children. And that was how we, found out that actually you can diagnose CF in Egypt. It does exist. And some of those patients actually did follow with us for a while. And Dr. Nasr got to see them when she visited. She does visit with us frequently, and she does see some of those patients with us. So she saw some of them.
How has it changed since you first were able to diagnose until today? What have you seen as far as being able to get medication or enzymes and life expectancy and all of that?
Okay, so I work at the Cairo University Children's Hospital. This is a very large referral center. So I don't think that the number or the type of patients that we get are actually, anywhere else in the country, because we usually get the patients who are very difficult to diagnose, who are referred from other hospitals or clinics because of their, difficult situations. From that study, a lot of interest has grown, and we have started to spread awareness about CF among the medical community, like among our colleagues. We would talk about CF, and then this paper got published, and that was generated some interest in CF in Egypt. And patients started to come to us. And over time, we got a better, my colleagues in the Cairo University Children's Hospital, they have also started doing diagnostics and follow-up for CF patients. And now in our Cairo University, we have the macroduct system for diagnosis of CF. Dr. El-Falaki, my professor, she is the one who brought this equipment, and she started testing for CF in the same way. And she diagnosed, because of this, more and more patients are being diagnosed. And we have regular, once per week, a CF clinic where we do follow-up for patients with CF. And we also continue to do this with them. So in terms of how the patients are getting support, I have to admit that a lot of the CF medications that are necessary for CF patients are not available in Egypt. And furthermore, even if they do become available or the parents somehow manage to get them, a lot of times they have to pay for them. They are not covered by national insurance or by private insurance. So this complicates things a little bit. In addition to that, CF care is relatively new for us. So we don't have all the support from a nutritionist, a dedicated nutritionist, and a dedicated person for physiotherapy, and a dedicated nurse for CF, and so forth. We sort of try to collect these services together in the clinic. But to establish this kind of care only for CF patients, I think it's much better than before, of course, but we are still not there. The medications, we are starting to get the enzymes now. Now it's 2020, and I started doing the study in the year 2001. So that's like 20 years later. Now we are getting the enzymes to be available. The inhaled antibiotics are still not available. Preparations for inhalation. The modulators are not available.
Dr. Nasr and I have talked about this before, but what is the life expectancy now for the patients that you're seeing?
Before you, Maggie, you answer, if I can add one thing, the sweat testing equipment that Cairo University bought in 2007 is the only one really in a place that takes care of CF patients. But just last week or the week before, we were able, after working with the CF Foundation and the Middle East CF Association the CF Association I've been working with for the 3 years, and then the CF Foundation, I've been talking to them about that for lots of years, actually. And now we have 4 more sweat testing machines delivered to universities in Egypt. But again, they don't know what to do with the treatment yet, so it's a long road ahead.
So how many total, Dr. Nasr?
4, and they're spread over Egypt. So 2 in the southern part of Egypt, 1 in Cairo, 1 in the northern part of Egypt, like an hour away. So there are some private labs, but I don't trust the quality of their work. But this equipment is also a macroduct equipment, and we are having a lot of oversight for the Egyptians to help them out because they really don't know CF yet. Cairo University is ahead of a lot of the places in Egypt, but the rest of the country is really need a lot of help.
Thank you. So, Dr. Naguib, maybe if you can talk about life expectancy and then about when Dr. Nasr came and how much that helped, or even if you're going to visit Dr. Nasr at U of M, that experience as well.
All right. The question about life expectancy, that's quite difficult because the patients that we are seeing in Egypt, we have noticed that their symptoms or their presentations is different from the typical CF presentation. Okay, so we have a different patient experience and, of course, variable severity of disease and a different genetic profile. So the genetics are also different for us. I cannot say for life expectancy because for this you need a national registry, and we don't have that at the moment. So I don't know life expectancy, but the first patient that we diagnosed, Dr. Samya may remember, Yusuf, he lived to the age of maybe 11. And this family had lost a couple of children before him in the first 2 years of life. So for him to live to the age of 11, by itself, that was a big deal for them. Still far from any good age, but still for them, it was a big deal.
I do want you to tell us about the impact that Dr. Nasr had, but first I wanted to ask a question before I forget. And Dr. Nasr, you can answer this also, but when we talk about COVID and the vaccine, are you on a level playing field more so than with CF drugs? I mean, you will get the COVID shots, right?
Okay, so the COVID vaccine, I think the government has an agreement with China for the Chinese made vaccine, and it should be available for whoever needs it. So for whoever wants to take the vaccine, it will be available for free. Concerning, what was your second question?
How things changed once Dr. Nasr started helping you there in Egypt, in Cairo, and then how important it was for you to go to the University of Michigan and see what was going on there in relation to CF.
If it weren't for Dr. Nasr and the CF Center at the University of Michigan, I wouldn't have learned anything about CF. Probably it would have happened at a certain point in time. But as you see, it takes decades for something like this to be more established. So Dr. Nasr has helped us tremendously by supporting, the diagnostics, by visiting us at Cairo University on several occasions, like seeing the patient herself, and by helping us with contacts and networks and giving awareness talks for us and for our colleagues and participating in our conferences and giving talks about CF. She's been actually of tremendous help for us. And we always turn to her when we have a problem, what to do with a patient, or we're thinking about starting something in the clinic. She's been super, super, super supportive and helpful for our CF service. Not only to us, but she's also, a speaker in some of the national conferences for pediatrics. So she's also reaching out to, as she said, University of Alexandria, University of Zagazig, Asyut, like all over Egypt, different universities. And through the MECFA, it's supporting them to get sweat testing equipment and to start their own services, start to diagnose the patients and build their own experience and so on. So it's been a long road, but still I have to admit that the number of CF patients is not really that large. And we do have like a lot of diseases, especially the less common or the rare diseases, that struggle with getting funding for special, medications or treatment, or approval of some of the drugs that are necessary for these patients and that are not currently available to us.
And I had a question. I know Dr. Nasr talked about this a little bit before in other interviews, but I'm wondering, so you have to wait for the Ministry of Health to recognize CF there in Egypt, correct, for it to be covered by insurance? And then I was also wondering, does the World Health Organization have a role where it can level the playing field for cystic fibrosis so that you can get everything you need? I can't stop thinking about the fact that we're all not on a level playing field. It makes me so mad. Like, why can't you have all the things you need? Like, who do we need to go to?
Okay, so essentially, the medications that the patients need, apart from the newer modulators, but talking about the basic, like the inhaled antibiotics, like the specific enzymes, like the fat-soluble vitamins and all of this, these are quite costly. Patients get them through their relatives or their friends or buying them out of the country and so on. Some of these medications are now in the process of being approved or licensed. It's similar to getting an FDA approval for a drug. So you need to get it approved by the Ministry of Health so that it can be available in the market and available to the patients. Some of these medicines are not approved by the Ministry of Health because it's a very long and costly process that requires that the drug companies spend a lot of time and effort and money to get these papers completed. A lot of the companies, they don't see an opportunity in treatment for CF simply because there is not that many CF patients. It's not like paracetamol where you have everybody using it, or some antibiotics where it will be prescribed a lot more, but a very small number of people require those drugs. So in order for the companies to proceed with all of these tedious and costly procedures, they require to have a certain distribution, which unfortunately for a disease like CF, it did not reach that point of momentum to acquire this kind of interest from the companies.
So, Dr. Nasr, is this something like we could have I don't know, like, is there a solution? Is there anything we can do in America? Is there anything do we have to raise funds for the pharmaceuticals so they can afford to do this for places like Egypt? Or is it not that simple?
Well, so I think, like Maggie said before, that the number of CF patients are not that many in Egypt. And I estimated it as around 1,000, maybe a little less than that between the different centers. But that number will increase because now we have the ability, not everybody can come from the southern part of Egypt to be tested in Cairo, which has been the process. So now that we have two dedicated centers or universities in the south is really helpful. And then also in the north, I actually contacted Alexandria University, and even though they did not get the equipment, they rely on a lab they said is credible. So that will be included as well. So I really think the process moving forward is going to be making sure the physicians there know how to test for CF and who to test for CF, establishing some sort of a registry so we can find the patients. Because what happened when I go there and, they said, oh, we want you to see patients. They have their cell phone numbers and they call them to come. There is no medical record to speak of. So establishing a medical record or, a system for these patients so we know what symptoms, survivals, all of that stuff would be very important. Once we reach a reasonable way of finding how many patients in Egypt have CF, then you can go with the advocacy. So the advocacy is really going to be to the Ministry of Health to acknowledge and state that, yes, CF is a disease. There's a lot of medications now that comes to the country, either legally or illegally, but it's not covered by insurance. Like Maggie said, a lot of these people are very poor, so they cannot afford it. And that's who they die like before 1 or 2 years of age even. So I think the road ahead in Egypt is a long road, and I am very invested in it. And my colleagues in Egypt are wonderful to work with. You just start with the process, and then all of a sudden everybody's excited. I mean, when I go to Egypt, I go every year for this Egyptian Pediatric Pulmonary Congress that I'm a co-chair for somehow. And they come to me. I mean, everybody comes to me and say, we have these patients and what do we do with them? They're eager to get with a program and organized. They really are eager to be organized. And that's what really I'm going to be moving towards, and with the help of MICFA, the Middle East CF Association. So there is a lot of interest in global CF care, and Egypt is just right there. I mean, I joined MICFA because of Egypt, because I really wanted to work with Egypt. So there is a lot of things that we can help them with, and it's going to take some time. My team is ready to go. They are because it's not only about the physician, but about the staff and the other part, the dietitian, social worker, the nurses, and everybody is very excited to be part of it. So we built the momentum, and now we need to go on with the process with them. So we just had the first step.
So exciting. I can't tell you enough. You're so amazing, Dr. Nasr. I love you so much. You are the best.
I love her too.
Well, I love you too. And I love Maggie. Maggie's like a sister to me. But yeah, we really going to be relying on all the faculties in there to go on with the program, which they will, because they've been very excited. And, I'm willing to help out. If it's not me, I can reach out to some of my colleagues to help. So, because we know the resources in the US, they don't have anything in Egypt. So it will be really helpful to them.
Thank you. And so, Dr. Maggie, how excited are you about the future, knowing what Dr. Nasr is bringing and just what you're able to do at this point?
I think this opens a whole new frontier. I mean, like we talked about 20 years ago, nobody knew anything about CF. These patients were lost. I have a slide in my teaching set about Yusuf, one of our first patients, and he presented to the clinic at the age of 1 year, and his weight was 3 kilograms. And just by being diagnosed with a sweat test and being offered some enzymes, he actually survived, and he was a fighter. I mean, he survived a lot. He had a very, very severe pulmonary involvement and he wasn't doing that well. But just by giving him enzymes, he gained a lot of weight. He was doing so much better. And well, he did not really survive for a very long time, but 10 years more than any of his other siblings did. And that was very exciting. You bring something that it's a solution, for a family that has lost several children. And, it feels good and bad at the same time. So it's bittersweet. They understand the limitations of having this type of disease for their child. But at the same time, they are hopeful that there is something they can do instead of just sit there and do nothing. So I'm quite hopeful that the younger generation of doctors are hearing more about CF. They are being educated more about CF. So more patients will get diagnosed and probably start on a treatment plan as they need. If we have a growing body of patients, they are already having these little groups on social media and communicating with each other. So once we have enough of these patients, maybe they can have like a pressure group or a focus group that can stimulate more and more help for them. And it's a very exciting few years back. We never even thought CF modulators was going to happen. And now in the past few years, we have not one or two, but like 4 of them already. I'm not saying that they can help Egyptian patients because still the price tag on the CF modulators is far from being affordable to any of our patients. And maybe if you talk to the twins' father, Anas, he will be able to elaborate on that. Because he has 2 children, and sometimes the mutations are not identified because this also takes a big process of lab investigations and so forth. So we still even are not sure if the modulators are going to be helpful or not.
So Dr. Nasr, when Dr. Maggie talks about the mutations not being identified, does that mean like where we know my kids are Delta F508 and then the residual mod thing that, that I can't even remember what that is. But so you in Egypt don't have the ability right now to detect what mutation they have. Is that correct?
Well, there is some labs. Yeah, there are some labs that do it. And also there was a colleague of mine that worked with MICFA as well from the Czech Republic who did some mutation analysis for them. And I know MICFA is now trying to find more people that can do. The problem is even if you sequence the whole gene, sometimes you don't identify the mutations. So it is difficult to identify because some of them, I have some patients from the Middle East that I have no idea what their mutation is because they already went through the process. So my colleagues from the Czech Republic was able to identify a lot of mutations from the Egyptian population. So you can, but it just costs money. They don't have the resources. So it has to be somebody funded by industry or funded by the foundation to be able to do the testing for them.
Gotcha. And thank you. Anything else, Dr. Maggie, that you wanted to add, or Dr. Nasr that you think she should talk about from the perspective in Egypt?
Just that thank you very much for your interest in Egyptian CF patients. It's very rewarding to have people on your side. So thank you. Dr. Nasr has been a tremendous help for the past 20 years or even more. She's been very supportive in many, many ways. So I thank her too. And I really wish that, to see the day where patients in Egypt get all the type of CF medicines or help, like specialists in CF care with no restrictions whatsoever, and to achieve, their full life potential. And that would be awesome.
Yeah, I think I agree, Maggie. That would be great. And like now they don't have pulmozyme in the country. They don't, I don't know, you have hypertonic saline, Maggie? I don't know if you do.
Yeah, we have the simple things. We have hypertonic saline. A lot of the inhaled antibiotics, we use the IV preparations, so still off label.
But not the tobramycin, it's just the gentamicin, amikacin, right?
Yes, and these are the IV preparations,
Right.
not the inhalation solution. And still, the pulmozyme, we don't have that available. The Mucomist, we only have a solution for oral treatment. We don't have the specific treatment. We have an IV one that we use for inhalation as well. So a lot of the inhalation medicines are still not available. The physiotherapy is a big deal because the family is already burdened with a lot of things, and they need a lot of help with doing the daycare for patients. They have to pay for almost everything out of pocket. Our clinic at the university does support some of the patients. We do offer some of the medication as we get them. They're free for whoever needs them, but they're not always available. So it would be great to have all of these facilities. Well, I have to be fair that 10 years ago, none of this even existed. So I'm really quite grateful that we have come that far. But still, I'm hopeful that we can do better.
Right. And for airway clearance, because a lot of the families have a lot of children, so really to ask them to do airway clearance twice a day is not going to happen because of what they have to do, especially if they are, from the lower socioeconomic class. But offering something like an a cappella or aerobica would be an alternative because they're not going to get the vest. The vest is too expensive. It's not available in Egypt.
Mm-hmm.
So if we can get some vests to go to Egypt, if it's donated, it will go to a university setting where they can use it for the inpatient side, which would be great because also they don't have availability of PT or RT to do the airway clearance for them. If we can support centers with a couple of vests each, that would be wonderful. And then we can also try to get them to have the a cappella or the aerobica, which is easier to use, and patients can use it by themselves.
And also to support, remember Dr. Nasr, when you and all of the team, they came to Egypt for a visit and we did a workshop and they were very helpful in educating residents, doctors, nurses, and all of this. It would be great to have an education workshop for CF, like having somebody to teach physiotherapy for CF, teach nutrition for CF, because all of these are still based on individual, initiatives. And I think having a system of care or establishing a group or a team for CF care would be very helpful.
That's what we're going to be doing. We've done it. We're doing it right now with Turkey, and we're doing with the CF center there. They are already a CF center, so they're way ahead of Egypt in that. But we've done that. Our dietitian, social worker, our dietitian, physical therapy, and our RT went with me, and they were very, very helpful to the team. And actually, all their team members was kind of like stuck with them all the time to get more information. So, and then they came visited our center. So there will be a lot of interaction with all the centers once we go on with the process that's going to be proposed for MICFA to do, which they are very supportive of doing. So yes, the team will be coming. I mean, initially I will go to check each center to see what the needs are. And then after that would be followed by the whole team coming in for a week or whatever, amount of time to work with every center to make sure they are elevating their standard of care.
Fantastic. Well, thank you both again for your time. I appreciate it.
Yeah, thank you. Bye-bye.
Thank you.
In our next podcast, we will talk to Dr. Iman Foda. She is a professor of pediatrics at Ain Shams University in Egypt. The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, check them out online at thebonnellfoundation.org. That's BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, the science of possibility. and produced by Jag and Detroit Podcasts.